This is Mel Majoros. I am the Cancer Warrior, and this is how I embrace the new normal. Well, it was kind of hard for me to embrace the new normal at first, because when you're out of cancer treatment, your hair is short. My hair actually turned gray, as you can see. I have to go to the hairdresser and get it colored. So when you're done with treatment, you don't really feel like yourself. You don't look like yourself. But everyone is telling you, like, oh my God, you look great. And you're like, is there someone behind me? Because you can't be talking about me, because my hair is short and I still feel kind of, yucky from cancer treatment. I still get tired. When is this going to end? And, I think it's up to you. You can see that, well, I'm different now. And, the chemo changes you, the cancer changes you. And I think for the most part, I would say 99% of the cancer survivors I've met, it's changed them for the better. They want to go out there and they want to help other cancer survivors. Like me, I will go out, if somebody asks me a question, I will probably go out of my way to ridiculous lengths to find the answer if I don't know it. I think the new normal is something else that we need to talk about as far as talking about breast cancer and invisible illnesses, because people don't understand the new normal is chemo brain, for example. That can last up to 10 years after your cancer treatment. Sometimes you can still get fatigue after your cancer treatment, which is, it can be very frustrating when you look like you feel good and then you get tired or you get chemo brain and it kind of reminds you that you have cancer. So sometimes the new normal is always surrounding you, reminding you about it, but I think in a positive way. I joke about chemo brain. It's like, oh, well, sometimes I can't remember things. Well, maybe somebody else who sees this video is like, that makes sense. That happens to me as well. But I'm not going to make it feel like I feel stupid. Because in the beginning, I was just like, well, I can't. I'm trying to introduce a friend of mine to another friend of mine. And I'm like, and this is my friend, and you feel kind of dumb, but it's not really anything that you can do about it. So you just have to embrace the changes in your life and figure out little modifications how you can go on from there. Because, cancer can take a lot out of you, but you can also put a lot back into yourself.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.